Hello, good evening, and welcome to the Functional Solution Podcast and class brought to you by the American Academy of Functional Health. Hi, I'm Dr. Tal Cohen. Joined with me is my wonderful co-host, Dr. Esha.
Hi, everyone.
So if you're interested in learning about the root causes of chronic diseases and walk away with practical evidence-based tools that you can use in your practice, you're in the right place. So every week, myself and Dr. Esha are talking about different topics. We're talking about different conditions or different symptoms, and what would that look like from a more functional, integrated perspective if a patient comes to see you and they're asking you, what is causing my sickness? Or what else can you offer me beyond a pharmaceutical prescription? So today we're gonna talk about one of the major challenges we have in healthcare in our country, and this is the weight gain and weight rebounds. And so one of the reasons why we picked this topic is because we have so many amazing practitioners in our community, from nurse practitioners, physicians, nurses, pharmacists, PAs, who are doing amazing work for patients, right? And many of them so many patients are coming in and they struggle with weight gain. And we know that weight gain is not, to many patients, it's not just an aesthetic challenge, but it's also, in terms of from our perspective as healthcare practitioners, we know that excess weight or obesity, right, is a major challenge when it comes to an increase of so many types of conditions, right, from cardiovascular to mood disorders to joint conditions, related conditions such as osteoarthritis, and all the ways to certain types of cancers, right? So this is a really, really important topic to talk about and give you, the practitioner, more tools and strategies so you can better help your patients. And so, Dr. Esha, I feel like this is a big topic.
Yeah,
And, right?
huge topic. And I do think that this is an area where um, we have to employ just ongoing education with our patients, right? 'Cause it's so easy to kind of fall off of the wagon, if you will, when it comes to the metabolic picture, because a lot of it has to do with behavioral modifications, which are some of the hardest modifications for patients to make, and just to make in general. So yeah, I would agree with that.
Yes, and I'm sure as a functional medicine physician with years of clinical experience, you have seen um, so many patients who are just struggling, right? Kind of
Yeah.
going from maybe diet to diet or trying different approaches, different things.
Yeah, I mean, you even see some of that happening with the GLP-1 medication crowd, right? Where they're even struggling to maintain a lot of times weight or see further weight loss on the medication. So I feel like it's a constant theme, regardless of the patient's chosen modality of, weight loss or metabolic improvement. You have to have those ongoing conversations because it's not just, a fad. It's like it's a lifestyle, what we say in functional medicine. So.
Yes, absolutely. And I'm so glad that you brought especially the most common, let's call them the magic pill
Yeah.
medication in the weight loss world, right? It become a very strong marketing, um, I would say even aggressive marketing
Mhm.
efforts with the GLP-1 agonists.
Yeah.
And it's interesting because in our community, in our functional weight loss program, in more specifically, we always have those discussions, right? A lot of the nurse practitioners and physicians in that particular program, the functional weight loss certification, come in and they already doing some sort of GLP-1
Right.
prescriptions, right?
Right.
They're doing weight management in a more kind of a primary care setting,
Hmm.
right? And we always talk about, you know, there's two challenges with that. One, the rebound effect is very much existent with those, right? Once the patient goes off the medication, there's we have to
Right.
think about that. So are we providing our patients with a long-term solution?
Mm-hmm.
How can we go beyond just temporary management of
Right.
the problem, right? And the second thing is there's always concern for potential side effects, right?
Right.
Because GLP-1 medication was initially developed and approved for type 2 diabetes.
Mm-hmm.
And while it could be very beneficial for patients, we also have concerns that, long-term use could lead to hormonal imbalances, can impact. There's even reports on wasting, so losing muscle mass,
Right. Yeah. Endocrine system.
endocrine system, and then there was one report that was looking at the risk of thyroid carcinoma with this type of medication. So we always discuss it, and how can we utilize all the tools that we have, right? So if it's GLP-1, some nurse practitioners started talking in our community, started talking about microdosing while we figure out the root causes, while we provide additional strategies, which we're going to talk about today. So I think this is an important topic to discuss, and discuss it openly, right? Without judgment of is it the absolute right thing to use certain medication or not. We're very open, even though we're very functional, integrative focused. We're very open to anything that can help the patient.
Of course,
right?
totally.
Right. And especially if it gets the patient into your practice, and that's something we talk more towards the end of that 2-month certification, is how to get the patients in. And yes, if I honestly believe, after being in healthcare for probably a little bit over 20 years, I'm like, if the GLP-1 kind of flag, right, of the magic pill gets them in your practice,
exactly,
and then you learn how to use, to learn the functional, integrative, more strategies to help them and improve their health provide a long-term solution. Amazing, right? That's probably going to be one of the best combinations you can have.
Yeah.
So when we talk about when we're talking about the this challenge, right, of obesity, weight gain across the United States, we know that it's ongoing and growing problem. According to the CDC, in 2023, more than 1 in 5 adults in across the U.S. Were struggling with obesity. So 1 out of 5. That is a very, very challenging number to think about. And there's an interesting peer review publication. This is published in the Journal of the Medical Clinics of North America. And this was published in 2018. So let's take a look at these pictures real quick. And this is essentially based on a meta-analysis of 29 long-term weight loss studies. And they found that more than half of the lost weight was regained. This is with individuals who are trying to lose weight, and more of the half of the lost weight was regained within 2 years, and by 5 years, more than 80% of the lost weight was regained. Right. So this is really looking at the, we're looking at the challenges here that we have in our country. And you can see here in this particular picture, we can see the obesity challenge across state by state. And so this is, again, it's one of our biggest challenges. You can see a few states are marked in a brighter or a darker red mark, which indicates a higher rate of obesity. But just to think about this particular study in 2018 that talked about the weight loss, right? And then looking at these 29 studies that show that, within 2 years, more than half of the weight loss was already regained, right? So we always have to think about that when we discuss long-term solutions. And of course, if we go back to kind of discussing what are some of the challenges that bring obesity, we know that there's a lot of factors we can blame, right? The industrialization of our food, highly processed, right? There's a lot more calories, right? Americans consume a lot more calories today than they used to, let's say, 40 or 50 years ago, right? The proportions of dishes, some dishes are bigger, but there's also, as healthcare practitioners, we always try to look at the root causes. And we know that some people eat as much as they want, right? And everybody maybe knows somebody like that, right? I have a few folks like that in my family. They just eat and eat and eat, and they stay kind of thin, and they keep eating, right? Even in their 30s, 40s, and 50s, they continue to eat a lot of food and they stay slim. So while other people continuously to struggle, and I'll never forget my first 5 years in healthcare. I was in my practice in the morning, and I was a personal trainer in the evening, because it's something that I'm very passionate about. And I saw so many individuals, they go into diets and they exercise and they struggle so much to lose a couple of pounds, right? And lose that extra adipose tissue, that extra weight. And some people, they just stay in a healthy weight and they don't even try. In fact, some people eat a lot more than they should and they still have a healthier weight. So to us, we always ask, why is that? Right? And that's exactly what we're going to focus on with our more functional approach. So we wanted to start by talking about what are the common mistakes, right? And the reason that one of the reasons I asked Dr. Esha to kind of share some of the common mistakes is because many of you might be listening to maybe many of you might be right here with us, and maybe of you might be listening from, maybe you're driving or maybe whatever it is, and you're listening to us and you're thinking to yourself, well, I'm already seeing those patients, I'm already giving them weight loss therapies and all of that, right? So understanding the common mistakes that patients make helps you to give the right guidance to make sure that they avoid those, right? And I'm sure Dr. Esha can explain that better from her perspective and experience.
Yeah, totally. It was so interesting when you were mentioning kind of the lean patients that can eat whatever they want and never, gain weight. I have a best friend that's like that. I mean, worst diet in the world. I don't think she's ever watching this, so she'll never hear me saying this, but worst diet in the world, and like has been the same size since undergrad, right? And then I have friends who are not like that. They literally notice small fluctuations with just, a change in their diet over a few days. So, there's something to be said about what you mentioned, all these other environmental factors, obesogens, chemicals in the environment, hormone changes, and other genetic pictures that we're not thinking about how we metabolize certain constituents. So, obesity, weight scenarios are so multifactorial. So when you think about common mistakes that cause patients to regain extra weight, say you have a patient that's on their weight loss journey, or you just want to help them maintain the success or guide them back if they start to slip, if you will. When it comes to the most common culprits behind like weight regain, we're going to just focus on two, and they're pretty big. Overly aggressive calorie restriction. And focusing on short-term diets instead of long-term lifestyle changes. I've seen this everywhere. People online, and even in my practice, people saying, I did the fasting diet, or I've been, doing one meal every other day, and I still gained a pound. And so there are certain physiological mechanics at play when it comes to weight loss and sustaining that weight loss. So the very first one, we're going to take a look at this image from a 2017 publication from the journal Nutrients. We're going to look at this energy gap that occurs and can lead to basically hormone and energy metabolism alteration. So I'll kind of go through this. So when you go on, so mistake number one, like we said, restricting calories too aggressively. So when you go on an energy restricted diet, right, so less caloric intake, your body's going to react in a couple of predictive ways. First, the calorie deficit and the weight loss that comes with it often triggers more hunger, while your body starts dialing down how much energy it burns. So scientists call this mismatch between how much energy you want and how much energy your body actually needs, the energy gap. And so what's happening behind the scenes, and you can see some of this in the picture, you're circulating signals, different hormones, different peptides, which stimulate appetite, and there's decreased anorexigenic peptides, which normally help to curb it. And so what happens is we're telling our brain, hey, we're in a state of nutrient deprivation. The result is more hunger, stronger food cravings, and a harder time feeling satisfied after eating. On the flip side, energy output goes down. Diet-induced weight loss lowers total daily energy expenditure. And then that drop comes from a reduced resting metabolic rate. So then a lower thermic effect of food and often less energy as burned during exercise and non-exercise activity. So we put these two together, and you'll see in the image where when this energy gap occurs, the GLP-1 picture reduces, insulin picture reduces, leptin. So leptin is a satiety hormone, helps to tell our brain we're full. So when that goes down, you kind of don't really have that feedback. So the hunger goes up, you're less full, less satiety, and you're less satisfied, right? You're less satiated. So you put these two together, like we said, more hunger plus less energy burn, and you kind of have a setup that causes weight regain pretty likely in these situations, especially in today's environment where we have high energy, ultra palatable foods, kind of addictive foods, and they're everywhere. And physical activity, our lifestyle is just different. We're more sedentary than we were previously. You think about some of the unique mechanisms, hormone disruption. Researchers have found a very strong correlation between decreases in leptin and then weight regain in patients. So that's that satiety hormone letting us know we're full, giving us that feedback. And then cortisol, when you think about excessive calorie restriction, we know that reducing our energy so dramatically, energy intake so dramatically, is actually going to cause an increase in cortisol, which has been shown to have a pro-obesity effect by suppressing that leptin-induced satiety. So all the hormones I always describe like this hormone soup, and some of the hormones are higher than the others, so the soup may be saltier at times or fattier at times, but the hormones should work together to give a perfectly balanced, soup, if you will. And so sometimes it can really throw that off in the system, and that leads to these down system effects, i.e. one of them when you're in a reduced caloric space is a pro-obesity effect with cortisol. Another one, postprandial gut hormones. We hear about the GLP-1 meds, and we've talked about this before and how your body naturally produces GLP-1. The studies have found that postprandial levels of the gut-derived satiety hormone, peptide YY, cholecystokinin, and GLP-1 are blunted in patients who lose weight through energy restriction or food restriction, calorie restriction, if you will, but they're actually increased in gastric bypass patients. So that just goes to show one of them is more you're kind of altering hormone pictures, calorie reduction, calorie restriction, energy restriction. The other one is actually a actual anatomical change to your gastrointestinal system that does not cause that same scenario. So, there are different culprits at play when it comes to how your patients or how we assist our patients in losing weight and sustaining that weight loss, and how that's going to affect them in the long run. And then the next mistake number 2, is focusing on diets instead of lifestyle. Diets are short term. I'm sure we all know this. They rely heavily on willpower and motivation, whereas lifestyle changes are a little more sustainable, a little more forgiving. They're integrated into our daily life and support long-term resilience. So several studies actually highlight dieting as a consistent predictor of future weight gain, right? So if your patients are, yo-yo dieting, this diet, that diet, it's highly likely that they're going to be somebody that continues with future weight gain and they're not sustaining that weight picture they want to see. If your patients are constantly trying different diets, they're likely going to suffer. So keep that in mind. In the journal Frontiers in Psychology, the result of 20 analyses involving restrained eating and then 20 others involving dieting revealed 2 different things. So restrained eating, less food intake, and versus like dieting, yo-yo dieting, those types of things. 2 different things they discover. Neither restrained eating or dieting predicted better weight control, weight gain, or weight loss. And then when they were able to successfully predict the degree of weight gain, they found that dieting was the greatest predictor of weight gain rather than like restrained eating. So just yo-yo, the practice of hopping from one diet to the other diet, it really can mess up that hormone circuitry and lead to kind of more chronic issues that we didn't think about. It's also been postulated that weight gain after dieting may be due to like metabolic, psychological and behavioral adaptations triggered by repeat dieting. And then one study found that both men and women who participated in formal weight loss programs gained significantly more weight over a 2-year period than those who had not participated in the weight loss program. So it just goes to show focusing on, diets is really not the key here. And studies have shown it over and over again, even if the diets sound really exciting and really promising, kind of helping your patients establish lifestyle modifications that, if they slip up here and there, it's not a really big deal. They don't feel let down because they fell off the diet and they got to get back on it, or all the psychological kind of warfare that goes on with that. But that's just a little bit. So again, mistake number 1, restricting calories too aggressively. And then mistake number 2 is focusing on dieting instead of the lifestyle. So those are huge predictors and factors that can play into why our patients regain weight after losing it, if you will. So let's hop into a quiz and just review what we learned. So quiz 1. Energy restriction has been shown to increase which hormone that may promote weight gain by suppressing satiety? So this is our stress factor. So the correct answer is B, right? So that cortisol increase that can happen due to aggressive calorie restriction can lead to issues with leptin and our satiety systems in the body. So this is just a little snippet. We have a ton more resources and information for you guys if you're interested in learning more about the root causes of metabolic dysfunction, diabetes, weight gain. We invite you to join the Functional Weight Loss Certification Program, and I think Dr. Tall's going to talk about it in a little bit. And then we also have kind of in your dashboard more information on, weight, more information on all these other factors that we've mentioned as well. So, Dr. Tall, what do you think about all of that? Isn't it so interesting kind of how, just the yo-yoing of dieting can really rewire the hormone circuitry and portend worse outcomes? I was reading a study earlier how yo-yo dieting actually has a negative impact on our cardiovascular system in the long run. Which I thought was so fascinating.
Yeah. The study that you mentioned in the Journal of Psychology was actually fascinating, in which they discussed it. The more diet somebody tries,
Right.
the more it's associated, at least, with a higher increase of weight gain later on. So I found that to be fascinating. And then calorie restriction, which you think about it, so many of the fundamental diets that we learn about, even just the word diet, what people think about is I'm going to reduce what I'm eating so I can lose weight, right? And while it is something interesting, because we, as a personal trainer, probably 25 years ago, that's what they used to teach us. And a lot of the dietitians are still based on there's a lot of great dietitians out there, but some of the dietitian kind of perspective of it is still, I'm going to count your calories. Now they have all these apps and all that stuff, right? And we're going to count your calories, and then I'm going to tell you what to cut off from your diet to make sure that you're only consuming under this threshold to lose weight. Right now Atkins diet and paleo diet and all that stuff, right? It's really interesting because a lot of it is like, oh, we're going to cut this whole food group, or we're going to cut out this food group, or we're going to cut calories in general. And it makes sense to us logically that if you eat less, then you spend or metabolize, right, number of calories, then you're going to lose weight. But the reality, and this is where we trying to replace this oversimplistic thinking that did not serve us very well. And if it was, then so many people would not struggle losing weight, right? They would just eat less and then the weight will all drop off, right? But the reality of it is that it doesn't work like that. And the reason why so many Americans in general are struggling with excess weight is there's a certain dysfunction, right? There's something is off. Something does not work properly. And that's exactly what we do with functional medicine. It's more like a personal approach to figure out, okay, What's wrong here? And we're going to talk about that more, I know, in detail. But I wanted to carry on what you were talking about, which is the diet and lifestyle habits. This one is obviously one of the most important fundamental of improving health and vitality. So, offering patients with evidence guidance, we always look at the evidence when we want to look at a certain, and I'm going to use the term diet, but what I want you to allow me to do is to use the term diet in a more kind of loose and open, and I'll explain what I mean by that. Most people think about a diet, they think about restricting things or counting calories or reducing calories, or I'm going to be hungry all the time, all that stuff, right? What we've been doing in our practice was really interesting, and this is something that we have the same strategy based on evidence that we used with so many practitioners that have went through our training, right? And what I want you to think of is not a diet necessarily, but eating patterns, right? So we'll call it eating patterns and lifestyle habits, right? Because eating patterns is something that you can apply, right? And then carry with you for the rest of your life. A diet is a short-term thing. It's hard to keep up with a diet. And so we're going to look at when it comes to movement, we're going to look at, there's a few things we're going to talk about, right? So combination like walking, right? Combination of any type of physical activity with eating patterns that provide our body sufficient amount of nutrients. We're not depriving our body. We don't want to trigger all these starvation pathways in our brain. We don't want to start changing our gut bacteria negatively. We don't want to get our body into this like low energy state, right? Because that's what happened in starvation. We don't want to harm our endocrine function as well. And we don't want to waste our muscles, right? So we're going to provide our body with all the food that they need. So we always tell patients, never go hungry. Like eat as much as you feel like your body requires. So and we're going to try to have eating patterns that will stabilize blood sugar, will support cardiovascular health, and help and support our metabolic rate. So when we do that, we would typically look into patterns such as the Mediterranean diet, right? So there's multiple studies I can talk about. One of them is a study was published in the American Journal of Clinical Nutrition. This was in 2015. It's called the SUN, like SUN, follow-up from University of Navarra. And essentially what they did, the researchers tracked over 10,000 participants for about 6 years. And they found that individuals with the lowest adherence to the Mediterranean diet pattern experienced the greatest yearly weight gain, while those that had the highest adherence had the least weight gain, right? Which all of those studies that we look at suggest that following the patterns of the Mediterranean diet can help protect against a weight rebound or gradual weight gain over time. Some studies even show a small reduction over time with following the Mediterranean diet. And so what are these patterns that we're talking about, right? These dietary pattern. So we're talking about high intake of vegetable, fruits, legumes, nuts, whole grains, and olive oil, right? Now, typically, there's some amount of dairy, mainly cheese and yogurt. There's some eggs and poultry, but there's lower consumption of red meat and processed meats, and of course, lower consumption of sugar. So how does all of these patterns really benefit in our body, right? And causing our body to shift towards a healthier metabolic pace. So let's take a look at a illustration from a published study in the journal Current Obesity Reports. This was published in 2022. And you can see here several mechanisms in which the Mediterranean diet improves obesity-related mechanisms. So you can see here there's reducing endothelial dysfunction on the top. There's reduced oxidative stress, reduced inflammation. We know that the high amounts of phytonutrients in those vegetables and fruits and whole grains helps to reduce inflammation. There's also modulating of the gut microbiota. So our gut loves fiber, right? So every time you eat something that is high fiber, right, your gut takes it in, ferments it, and creates beneficial metabolites that Dr. Esha is going to talk about next that contribute to weight gain. We also have improved immunity because, again, you're giving your body all the nutrients that it's supposed to have. There's improved lipid profile. There's and that comes from multiple factors. One, reducing red meat or processed meat. The second is the type of oil or fat that is used for cooking and salad dressing and all of that stuff. And then, of course, the phytonutrients by themselves are very beneficial. And there's also improvement of insulin sensitivity. So all of those are really important. And if you work with patients that are struggling with weight gain and or obesity, our recommendations, this is what we teach in the functional weight loss certification program, is to look at all of these factors. Look at inflammation, look at their immune function, look at their endocrine system, look at their gut, look at their environmental exposure, right? We want to take a look at the whole picture so we can provide them with a long-term solution, right? Not a short-term, not disease management, right? Or condition management, but more of a corrective care, right? So let's take a look at the top 4 principles that we would recommend to consider in your practice to help your patients to start transforming their health, right? So the first one is using olive oil as the major fat source. So there's a really interesting study. It was published in 2025 in the American Journal of Clinical Nutrition, and they found that olive oil consumption essentially was inversely associated. Increased olive oil intake over time was inversely associated with body weight, which means the more olive oil you consume, the lower your weight gain is, right? So it helps maintain healthier body weight. So, and why is that? It's a part of it is because the healthy monounsaturated fats, which seem to mitigate weight gain in compared to other fats, even when calories are not strictly limited, right? So that's one, olive oil. The second one is nuts and seeds. This is really interesting. A lot of patients sometimes look at us and say, well, nuts and seed are very high in calories. I'm going to gain weight if I eat them, right? Well, wrong. The interesting study that was published in 2014, it's called Long-Term Association of Nut Consumption with Body Weight. This was published again, American Journal of Clinical Nutrition, found that higher consumption of nuts over longer term did not lead to greater weight gain. In some cases, it was even associated with losing weight, with reduced weight, right? And the reason is because while nuts and seeds are calorie dense, right, they are also induce satiety, which helps you feel fuller, and they're really high in fiber, in protein, and healthy fats, which helps our gut bacteria, helps us to maintain weight regulation. So that's another one. The third concept is high consumption of vegetables and fruits. Of course, I'm sure it's not a surprise to anybody here that fruits and vegetables have phytonutrients, and they have a lot of fiber and essential nutrients such as mineral, vitamins, all of that, which also helps us with metabolism. And then the last one is reduced consumption of meat and sugar. Now, this one is a challenging one, I'll admit, because a lot of our patients like to eat meat and chicken and all of that stuff. I've met patients that eat a burger every day, right? That's kind of a staple in their kitchen or when they go to eat out. But the reality of it, that there are studies that are showing that total meat consumption is positively associated with weight gain in both men and women across different weight categories. One of those studies that we looked at, again, was published in the American Journal of Clinical Nutrition in 2010. And they found, essentially reported that lowering the intake of red meat and processed meat helps reduce excess consumption of calories and saturated fat, right? So it's not necessarily about how many calories do you eat, right? We just gave the example of a higher consumption of nuts. It's got a lot of calories, but it's associated with healthier body weight, while higher consumption of meat also have high calories, right? It is actually, it is associated with an increase of weight gain for both men and women. So the general recommendation, of course, is to reduce consumption of meat and sugar and utilize olive oil instead of canola oil and other oils, right? Use nuts and seeds, high consumption, daily consumption of nuts and seed, and consumption of vegetables and fruits. Now, if your patients eat out, that's always a challenge, but most restaurants will not use olive oil, right? So if your patient eats a lot out, try to explain to them the importance of either cooking at home some meals or choosing different meals than what they're used to, maybe starting their meal with fruits and vegetables or having sufficient amount of those. And then they can always snack on nuts, right? They can always carry with them nuts. It doesn't need refrigeration or anything like that. And just snack on it throughout the day to help keep some of this their hunger down. So let's do a pop quiz number 2. So which of the following is not a principle of Mediterranean diet shown to support healthier body weight? 1, using olive oil as the main source of fat. 2, eating plenty of nuts and seed. 3, high consumption of vegetables and fruit. D, high consumption of meat. E, reduced consumption of sugar. So which one of those is not a principle of the Mediterranean diet that was shown to support healthier body weight? And you should know this because we just talked about it, right? So which one of those is the correct answer? It's not the principle of the Mediterranean diet. So I'll give you guys a few seconds. And the right answer is D, high consumption of meat, which, as I mentioned, was positively associated with weight gain in both women and men. So, Dr. Esha, I know that this is one of the important topics to talk about.
Yeah.
And you're taking us now into another very, very important for healthcare practitioners to consider and look at.
Yeah, totally. We're going to talk about gut health. And I love gut health because it's like such an easy target, and it's like low risk, when you're targeting somebody's gut health and you're treating them with kind of diet or even supplements. I find them to be such a low risk thing, like probiotics and so forth. So let's talk about some other hidden factors that also contribute to metabolic dysfunction. Gut dysbiosis, right? There are other factors, hormone imbalances, environmental toxins as well. Each topic we can always deep dive into, but GI is so, I think GI is such a simple one because obviously everybody has a GI system and you don't know if everybody's exposed to the same environmental toxins or hormone imbalances, but you can always target like a gut picture. And so so with regard to the GI dysfunction picture, there are many things under the umbrella of gut dysfunction. I tell folks, from the ruta to the tuta, from the mouth to the bottom end, there's a ton of things that can go wrong. Digestive enzyme function, stomach acid issues, motility issues, the whole gamut. You see sometimes even like microbiome, gut barrier dysfunction are huge culprits for metabolic issues. There was a study I was reading, this was years ago, and it stood out so much to me. And they were talking about how the gut microbiome sometimes may be an instigator for metabolic issues because it's so uniquely tied to our metabolic health. Now we're going to focus on one specific gut metabolite, the short chain fatty acids. We're going to start out by looking at this image from the 2025 peer-reviewed journal, Biomedicines. And so short chain fatty acids are like usually 4 carbon molecules, which is why they're called short chain versus a long chain fatty acid. They're gut metabolites that typically occur when somebody eats some fiber, carrot or a piece of broccoli, and the microbes in the gut break it apart and they produce other little compounds called short chain fatty acids. So microbes, bacteria fermenting fibers to produce these really beneficial microbes. And so commonly, we refer to them as butyrate, propionate, acetate. Some tend to show more benefit than others. And so they're mostly associated with positive outcomes. So it was really interesting because in this study, I'm going to talk about this image. In this study, they found that when somebody has a dysbiotic microbiome, sometimes short-chain fatty acids may not always be so beneficial. And they were more so talking about specific ones like the acetate picture. And so when you look at this image, you see how they may have a dual role in obesity, exerting both anti-obesogenic and pro-obesogenic effects. So one, to the very left, that green is usually stimulating, right? So the green arrow, short chain fatty acids promoting the secretion of GLP-1 and peptide YY in the intestine. This is going to lead to decreased appetite and caloric intake, which leads to activation of the brown adipose tissue. We're going to see that these short chain fatty acids also activate AMPK, which is AMP activated protein kinase pathway, which basically enhances fatty acid oxidation and reduces fat accumulation. So these are positive aspects of maintaining healthy weight, if you will. And then to the other side, in contrast, in the context of somebody who has dysbiosis, short chain fatty acids have been shown to downregulate this other factor called fasting-induced adipose factor expression in your gut cells, enterocytes, thereby increasing your lipoprotein lipase activity, promoting lipid storage in adipocytes. So I typically tell folks, when you have a metabolic picture, like adding fiber, the Mediterranean diet is fabulous, but fiber sometimes is not enough to kind of really see the changes you want to see. And you have to kind of support their microbiome with actual microbes like probiotics. And so then the last one, excessive short chain fatty acid production, particularly acetate, can be utilized by the liver for fatty acid synthesis, contributing to lipid accumulation and increased energy extraction and increasing, fat storage essentially. So this again is like the art of medicine, right? We always think of short chain fatty acids as wonderful, great tools. And usually when you see short chain fatty acid supplements, it's usually always butyrate or butyric acid. You don't really ever see acetate in the supplement form. But I would definitely say that in the context of supporting someone's gut, when they have a metabolic issue, probiotics can be really helpful. And there's some studies around that. In another study, I want to talk about the Mediterranean diet first, how that impacts your gut health, since Dr. Tall just did a deep dive on the Mediterranean diet. In a 2022 randomized controlled trial, researchers studied 260 women with intestinal barrier impairment by measuring LBP, which is basically LPS binding protein. And LPS is a molecule that's released from gram-negative bacteria in the gut that can basically turn on the light switch for inflammatory cascade. I think of all like dominoes. If you were to line them up and you just hit one and the rest just kind of fall in line, that's how I think about LPS. Once you get it going, it's going to upregulate your toll-like receptors, CD14, and all these other little inflammatory pictures. So they measured their intestinal barrier with this LBP. So how much of the binding protein was hanging out in the plasma. They measured zonulin, which is a leaky gut barrier in the feces. And then they also measured their actual short chain fatty acid levels. And so in the intervention group, which was a Mediterranean diet, they found that the fecal short chain fatty acid levels increased, butyrate increased by over 40%, and then propionate increased by like 19%, which is really fascinating. And they were both statistically significant. And then a multivariate analysis showed that adherence to the Mediterranean diet was significantly associated with short chain fatty acid concentrations and inversely associated with lipoprotein LPS binding protein and zonulin. So we're reducing that inflammatory light switch, the LPB, LPS, and then we're also reducing that zonulin concentration. So there's the kind of thought of less zonulin in the stool, less intestinal barrier disruption, so less leaky gut, if you will. So that's the Mediterranean diet is just really fascinating in how it's able to support the gut microbiome through just having a lot of fiber and fresh fruits, vegetables, but also supporting these little microscopic areas of gut health that you can't see, the microbiome, but also the cell permeability. So turning down that leaky gut picture. So then let's take a little side note to probiotics. So let's think about specifically what happens when you add gut bacteria, so probiotics. In one study, supplementing with probiotics in overweight and obese adults led to clinically meaningful outcomes. One randomized trial found that supplementation with a specific probiotic resulted in an average weight loss of 3.2 kilograms after 9 months. And then with 40% of those participants achieving more than or equal to 5% body weight reduction. If you look at some of the studies around obesity, they typically will say, like, if you're able to lose like 10 to 15% of the body weight, that's a significant improvement in like overall metabolic health. So we're not like looking at these huge dramatic weight loss reductions to achieve like positive outcomes for our patients. Even these small amounts can lead to big changes overall. And then another double-blind randomized trial in overweight and obese, it was a placebo-controlled trial, in overweight and obese children, 12 weeks of supplementation with the multi-strain probiotic resulted in significant metabolic picture improvements, including body mass index, cholesterol, LDL, TNF alpha, that inflammatory kind of signaling messenger, and then how probiotics work, I'll give you these 4 mechanisms. So one, they're going to modulate the gut microbiome, right? So you're actually putting beneficial bacteria in the gut. 2, they're going to increase concentrations of the short chain fatty acids like butyrate, which is going to help with the energy metabolism, increase fat oxidation like we saw in that image previous. And then 3, they're going to reduce inflammatory signaling and improve your gut barrier. So like we talked about with that study where the LPS, LPB picture happened, actually that was Mediterranean diet, but this is probiotics. So 2 separate things. Sorry about that. So yeah, probiotics reducing the LPS endotoxin, they also do that. So think about the power of Mediterranean diet plus probiotics for your patients, which are not really groundbreaking therapies. Honestly, it's diet and it's adding probiotics. So that's wonderful. And then the last one is more appetite satiety regulation. So probiotics have been shown to also support the GLP-1 upregulation picture and so forth, which can reduce satiety, reduce hunger. And so I think it's a no-brainer when we have patients who have metabolic dysfunction, or they're trying to optimize, their metabolic health, lose weight, adding in a probiotic, changing their diet, adding in more Mediterranean diet is going to be hugely helpful in the long run. So I know that's a bunch of information. Let's test our knowledge. Let's do a pop quiz. Which of the following best describes probiotics' impact on inflammation? So increasing LPS endotoxin and promoting inflammatory cascades. B, decreasing adiponectin while increasing pro-inflammatory cytokines. C, reducing systemic inflammatory cytokines and LPS while increasing anti-inflammatory adiponectin. And D, they have no measurable effect on systemic inflammation. So the correct answer is going to be C. Reduce systemic inflammatory cytokines and LPS while increasing anti-inflammatory adiponectin. I don't think we mentioned the adiponectin, but it's pretty much an anti-inflammatory cytokine that you want to see increased in these type of metabolic situations. So again, this is a ton of information, but we have more information if you're interested in learning about this. We have the weight loss certification program, the functional weight loss certification program, where you learn this and so much more. We have other, modules on gut health and microbiome health, which I think is just the keystone of any functional medicine practice. So yeah, Doc, thanks for talking about the Mediterranean diet. It kind of looped perfectly into this section. And it's so fascinating how all the avenues in which the Mediterranean diet has been studied in. I mean, increasing intestinal permeability, right? Reducing the LPS is really amazing.
Yes, absolutely. And I'm so glad that you discussed this topic of this. It's a big topic of gut health. And so many practitioners, when they come to see us first, they are kind of they always ask us the same thing. It's like, why don't they teach this in the nursing or medical school,
Right.
right? And yeah, we all learn, we learn the same physiology, right? So it doesn't matter which program you go to, if it's a PA school or nursing or physician or NP or whatever it's school, you're going to learn the same anatomy
Yeah.
and physiology, right?
Yeah.
So it's not like we tell them, you know we discuss the gut integrity or the secretion of the enzymes or stomach acid or the beneficial metabolites, right, like the short chain DNA chain
Yeah.
fatty acids, or even the gut brain axis, right,
Yeah.
like bidirectional signaling. So it's not like they haven't learned about the anatomy and the physiology, right? But they haven't learned about it in this way, which
Right.
is,
Right.
what if your patient does have reduction in secretion of pancreatic enzymes? What if they have, because they have long-term type 2 diabetes,
Yeah.
right?
Yeah.
What if they have systemic inflammation? What if they have
Mhm.
disruption of the gut bacteria? What if they have dysfunctional or issues with the gut brain signaling, right? It's a very important system,
Yep.
right? Our brain controls so much of what's going on in our gut, not just motility, but the secretion of certain hormones and the diversity of the gut microbiome. And the gut microbiome directly through the vagus nerve sends those signals up. We had a whole class, you remember, we talked about like the gut brain axis and how it's directly and indirectly impact our
Mhm.
body's function. So it's really diving into the understanding of what's going on in our patient, right? So when you get a patient in, it's like looking at the understanding the mechanism. So you hear the signs and symptoms and you start understanding the patterns. It's like,
Right.
oh,
Exactly.
like this patient have struggling with obesity or endocrine imbalances because they're exposed to endocrine disrupting
Uh-huh.
chemicals,
Uh-huh.
right?
Yeah.
Now, yeah, you can prescribe them certain hormones replacement or whatever it is, but if you don't ask the right questions, right, and you don't address those issues, your patients keep gonna keep triggering or contributing to their dysfunction,
That's right. That's
right?
right.
Well, we're masking the symptoms here. They're going to keep on contributing to dysfunction, right? And that's why I always ask practitioners, how many of you over the years have seen a patient that starts with 1 or 2 medication, 10 years later or 20 years later they're on 15, right?
Mhm.
7,
Mhm.
11, 15 medications, right? Does that mean they're getting healthier, right? Not necessarily. In fact, if they're needing more medication or increasing the dosage, they're typically losing function, right?
Yeah. Yeah. Totally.
So yeah. So that's why I'm so grateful that you mentioned those, the gut, and we teach the clinical application very well, like how to evaluate it, what labs biomarkers to look at, and then of course what are the specific treatment protocols for each one of those.
Mhm.
So we can help practitioners to completely transform their results that they're getting and really become the go-to person.
Yeah, I had a professor in naturopathic school, Dr. Morstein, and she's brilliant. And I always think about this when we talk about probiotics. Is like, they have the holy trinity in religion, and I feel like the naturopathic holy trinity is always everybody that comes into the practice first visit. You're going to get a good multivitamin, fish oil, and a
Mhm.
probiotic. So every
Yes.
time I think of this, I think, okay, every patient that I see, if I don't have a plan or a protocol, what's that first visit? If I don't know what to do, if I need the time to think on their case, and probiotics are just a no-brainer. So that kind of sticks with everything that I see for the most part, include especially metabolic issues.
Yes, absolutely. And the way and I'm glad you mentioned it, because we also had our staple and fundamentals for each,
Mm-hmm.
like, each type of condition or, whatever it is in our practice. But it's really interesting that the more over the last few years, in the not just the philosophy, but also the way we the practical application that we teach is being more and more fine-tuned to more of a, like, a very specific, we call it precision medicine, right? Which is essentially saying the better tools you have and strategies, the better you understand the mechanism, you can tailor almost perfectly to each patient the types of dietary patterns or supplements or herbal medicine or whatever it is to make the biggest change.
That's right.
Right. So when they come to see you on a regular basis, 3 months into it or 4 months into it, they're coming back and they're saying, Doc, you helped me so much with my energy, with my weight, with my sleep, with my all of that stuff. Right. And that's why it's so important. So it's amazing that you mentioned that. Now, as we complete our session, I wanted to talk also about give you guys a few recommendations for supplements. So let's dive into that. So we always look at evidence base and what it is that we need to do when we look at gut target supplements. So we're going to look at and when I say gut targeted supplements, Dr. Esham mentioned these two particular studies. For example, one of them had like a 3.2 or kilograms lost, and some participant had like 5% body weight reduction, right? So it's really interesting when the targeted protocols, we already know based on research what are the specific strains, what are the specific supplements, compounds that will get that benefit. So one of them is, for example, the Arcamansia municipila, right? Those strains have been shown to support weight parameters. And then there's a couple of products that I wanted to also mention, which are more based on fiber. So one of them, I'm going to show a picture right now, two of those. And you can see Pure Lean fiber, which is, it's a patent type of fiber. It's called Pratik X, Pratik XO. And then there's another product that is called Metabolic Daily Pro, which both are really good to improve metabolism, but they contain multiple prebiotics, which is great. They contain apopectin, for example, and typical, the typical serving per day should be a really good supplementation for most of those patients that are struggling. For example, what I like about the Metabolic Daily is that it does include the live probiotics that are more specific strain of Akkermansia, and those were found in some studies to be beneficial, right? So we always want to think about, probiotic, but what probiotic, right? What probiotic more specifically for the patient in front of us? So if they got arthritis, there are certain species of, or let's say species of bacteria that are more beneficial for arthritis. If they want to lose weight, there are more specific species of probiotic, and there's better types of fiber that we can utilize for that specific condition, right? So now that we talked about a few of the root causes, we talked about common mistakes that patients make, which is counting calories, reducing calories, which shift their hormonal endocrine system. We want to talk about where do you take it from here. So hopefully you learned a lot today about common mistakes, what types of dietary pattern you should already implement in your practice or consider implementing, and then what type of products, and of course the gut, which is a big topic, right? If you're interested in taking it further and diving deeper into metabolic dysfunction, diabetes, and weight gain, we're going to show the picture of the functional weight loss certification next, which really covers the evaluation and all the treatment protocols and the biomarkers in the labs and where do you get those labs and supplements. And you also get a clinical guide, which is quite amazing, which specifically have protocols for that type 2 diabetes, sugar craving, weight gain, gut, endocrine, hormonal imbalances. We cover a lot of these topics in this training. And I'm going to show you the next picture, the 2 months. What do you learn during this 2 month certification program? And that every week we essentially cover one root cause in depth, including the mechanism, the treatment protocols, and the case studies. And there's a live class on evening. It's one evening a week, an additional 2 hours of self-learning through video classes and quizzes. So you can see week 1, for example, we dive deeper in understanding the physiology and what happens in the adipose tissue. Week 2, we dive into neurotransmitters and hormones. So what's going on in our gut, what's going on systemically that impact weight gain? How do we address those imbalances? So if your patient has high estrogen, high cortisol, low testosterone, you learn treatment protocols specifically for that. We go beyond pharmaceutical, so you get a lot of tools. Week 3, inflammation and metabolic dysfunction. Week 4, we talk a lot about gut microbiome and integrity. Week 5, endocrine disruptors. And then week 6, clinical application of diets and nutrition. Week 7, we go into specific targeted supplements for weight loss, cravings, and insulin resistance. And week 8, we talk more about the business of functional weight loss and how our community are already able to get clients on their as soon as they complete the training, right? So we talk about how to get clients, talk about how to communicate better, and how to build your own functional weight loss program for your community. So right now, if you're interested, we are offering a $2,000 scholarship to healthcare practitioners, which brings the price, and I'm going to show it in the next picture, from $2,950 to just $950. Includes the live classes, includes the recording of all the classes, includes all the clinical guides. And this scholarship is only until the end of the month because we're starting in October. And this would be our last program for the year. So if you're interested, this is the best time to look into it. Reach out to us if you got any questions, and we would love to help you. Additionally, what I want you to think about is if you're interested in functional medicine certification with experienced mentor, practice building classes, let's show the next picture, then I would probably, and you want to go beyond metabolic dysfunction and weight gain, you want to learn about specific protocols for most chronic conditions that you see in your practice, cardiometabolic, autoimmune. We go way beyond what any other school out there delivers in their functional medicine. And I guarantee that. Because we have 11 specialties that no other schools talk about, such as the autoimmune, men's health, women's health. Metabolics is also included in that. And then we have geriatric conditions, chronic pain, neuropathy, mood disorder, neurological disorder, geriatric. We have pediatrics. So everything that walks into your practice, you already know what's the root cause, what do I need to do with them, what are the protocols. And so I'm very excited for each one of you. You can check out on our website some of our graduates. So reach out to us. And for all of you in our program, not just our guests for today, but all of you in our program, remember, you have amazing mentors with years of clinical experience, like Dr. Esha, Dr. Chill, Dr. Kim, right? And they are there for you. So book a call, do case studies with them. We have practitioners literally while they go through the program, they are already building their functional medicine practice, right? Some of them doing it on the side, right? But some of doing it kind of transition into more full-time now, doing it while they're going through the certification programs, which is incredible. So we are here for you. The mentorship calls, one-on-one mentorship calls, are included in your advanced and clinical functional nutrition program, right? So, and we include those for like 2 years. So we're here with you to build your practice and be successful. So let's take a few questions, and then we'll be done for tonight. So first question is, how much olive oil? So while olive oil, like every oil, is high in calories, typically what I would recommend patients is to use it for cooking. So typically between 1 tablespoon to 2 or 3 tablespoons, depending on how much you cook. You need small amounts, right? So 1 or 2 tablespoons will be enough for stir frying, whatever it is that you make, and if it's eggs or whatever it is, right? This is a good alternatives to butter and canola and everything else, because we know that butter is high in saturated fat and increase your cholesterol, and then olive oil is actually beneficial for your cardio metabolics. I also recommend to use it in salad. So use it in moderation, right? Like everything else. Like 1 tablespoon is great with salad, or dressing is great. So it's something you can add, right, to different foods that you're making, but in moderation. Hopefully that answered the question. This question: how would you do a targeted or general probiotics if you're done gut testing? So that's a really good question. I can give you the long answer will take us probably between 6 to 8 hours. The short answer is it really depends on what I'm seeing in the labs. So if I am seeing, and at which phase I want to use probiotics, right? So if I'm seeing a state of dysbiosis, for example, high increase of harmful or imbalanced bacteria, right? At that point, I might put probiotics to the side and say, well, now at this phase, we maybe want to do a 30-day or 60-day antibacterial herbs or compounds, right? So that might be the better approach to do, because we want to clear off bacteria that is not beneficial, or it's causing inflammation, or is triggering some sort of metabolic dysfunction, right? So we want to get rid of those excess, let's call it overgrowth, right? And the medical term is SIBO, or small intestine bacterial overgrowth. And then, so that will be the first step, right? Now, if I see that there's a deficiency, the problem is deficiency in some beneficial bacteria, then probiotics is the more appropriate solution, right? Because now we're trying to supplement that. Now, of course, Dr. Esha talks a lot about fiber, different types of fiber. So different types of fiber, it depends on which short chain fatty acids are you trying to increase, if it's butyrate or something else. And then, of course, what else are you seeing there? Are you seeing, if you're doing a comprehensive analysis, you'll see secretory IgA, which is a marker of inflammation or immune function in the gut. You'll see the pH. You'll see all sorts of things, right? So it's really depend on what they're. The recommendations or considerations we have here is really general. It's like fiber, probiotics, right? So that will be dependent on the test. So that's essentially, hopefully that helps. Metabolically broken, overweight individual, do you give general probiotics until you can maybe give a gut test, or you have gut test right? Okay, so that's a really good question. Would you do the test first and go with it, or will you do wait until you have the gut test? So the general approach that we like to take is give them something that was found beneficial to support healthy metabolism, right? Now, I know I'm talking in very general terms because it also depends on where they are. But let's say I'm taking an example, a patient, they came for weight loss. They're struggling with some digestion problems. Without testing, I really don't know what's going on there, right? Now, of course, I can recognize the signs and symptoms, right? So even if I don't have the lab test in front of me, I can recognize it. For example, if I ask the patient, do you have gas and bloating and abdominal discomfort? And they say yes, and it's in between meals, I'm like, okay, well, there's really no mechanism in our body. There's no organ in our body or cells in our body that can produce gas, right? So we know that physiologically, it's probably overgrowth of certain bacteria in their gut, right? Now, of course, that's where we dive into the gut module in more detail, because is it after meals? And that could be, is it upper GI? That could be, means that they maybe have lower secretion of hydrochloric acid. And so they get bloated, they get discomfort, right? The food is not breaking down properly. If it's like, if it's in between meals, it could be more SIBO, small intestinal bacterial overgrowth. So I don't need necessarily the lab test to start, right? So if it's low hydrochloric acid, maybe I'll prescribe some enzyme therapy or HCl supplement, right? With meals to help them break down the meal. If it's in between bloating in between meals, maybe I'll do some very mild antibacterial that can support the gut, like very, very mild, like maybe green tea, right? Supplement of extract of green tea, right? Or extract of garlic, right? So there's different things we can start modulating. Remember that green tea also have phytonutrients. Garlic is also a prebiotic, right? So it also have fiber. It also helps the bacteria, the beneficial bacteria, to also grow. I will try to stick to more general concepts, and this is something we talk more about in the functional weight loss program, because we already have those protocols for month 1, month 2, month 3. You're typically going to get your lab results on the second month or the third month, and then you can start open up your the clinical guide and say, oh, I see that they have hormonal imbalance and blah, blah. Oh, I see they have exposure to endocrine disruptor. Oh, I see that they have this problem in their gut. You have the protocols for that. But I would start with general, right? Address what you see based on the signs and symptoms, and address everything. You see signs of inflammation, right? You don't necessarily need a lab test for that. You don't need to have a CRP test in front of you. If the patient say, I got chronic joint pain, then guess what? It's right. We all know this. It's probably inflammation that is involved, and it's chronic. So if that's the case, I'll look at an anti-inflammatory protocol to send the patient home, right? Because we know that if they have systemic inflammation, it will impact their endocrine system, and it will impact their metabolism, right? So I'm super excited just talking about it, because I can, as I'm talking about this, this like the approach and the mechanism and how you translate it into practice, I also see the pictures of the patients that I've went through this, and I know when they come back, they typically tell me, oh, you know what? I came here for weight loss, but I'm also have less pain. I have more energy. I have this. Like this is why we're here. It's like looking at it's not just dealing with conditions or diseases, it's health and wellness overall. That's the best gift you can give your patient, is like improve their health. Every month they come to see you, their health and function is a little bit better, right? That is the best gift we can give to all our community members, right? That would be a legacy that is worthwhile the investment of time and effort, right? And that's what we're here for. So I thank you so much for being here. I know we're a little bit over time, but I wanted to make sure I answer all your guys' questions. If you got questions about our programs, reach out to us. We really provide so many resources and mentors, and so many things that we try to provide you, from practice building classes to a personal one-on-one mentorship to everything, to be successful in your career and really become the go-to person for your community. So I want to thank Dr. Esha for taking the time from her busy schedule to share her clinical experience, the team who is putting together the resources and clinical studies for us, and then of course the media team and Jacob, who are amazing and allowing us to be with you wherever you are. One thing that I also wanted to mention is we have a workshop this Saturday where we're working on building a treatment plan for functional medicine treatment plan. So that'll be awesome. You guys are all invited. If you are in our functional medicine program, then you get a ticket to that at no additional charge. Your ticket is on us. And then guests are invited too. You can reach out to our admission team, ask them how you can join. And so I appreciate all of you for being here, investing time and effort to bring this approach to your community. and be the guiding light for your patients. Thank you so much. Take care of yourself and have a good evening.